If you've been told you have a fatty liver, I want you to listen carefully, because in the next few minutes I'm going to show you exactly how to reverse that condition, clinically, safely, and effectively within 90 days. No gimmicks, no miracle pills, and no herbal shortcuts. Just evidence-based nutrition, lifestyle, and metabolic correction. By the end of this talk, you'll know the precise steps thousands of patients have used to normalize their liver enzymes and melt away excess fat from their liver cells. Now let's begin with what fatty liver really means. When more than 5% of your liver cells accumulate triglycerides, that's medically known as hepatic steatosis. This usually happens because the liver receives more fat than it can process. The fat can come from the diet, from increased production inside the liver, or from the body's own fat stores when insulin resistance develops. If left unchecked, those fat-filled liver cells can become inflamed, leading to fibrosis and eventually cirrhosis. But the good news is, early-stage fatty liver is completely reversible, especially with the right clinical diet strategy. The first thing we address is energy balance. Most people with fatty liver consume more calories than their liver can handle, especially from refined carbohydrates and saturated fats. In clinical practice, we recommend a controlled caloric deficit, typically around 20% less than maintenance level. For most adults, that means reducing 400 to 600 calories per day through structured meal planning. The goal is gradual, steady weight loss of about half a kilogram per week. Rapid weight loss can actually worsen liver inflammation, so we aim for slow, consistent progress. Next, we control macronutrients with precision. Protein intake must increase, not decrease. Clinical studies show that sufficient lean protein, about 1.2 to 1.5 grams per kilogram of body weight, helps protect muscle mass and supports liver regeneration. High-quality sources include skinless poultry, fish, egg whites, low-fat dairy, and legumes. Protein also reduces appetite and stabilizes blood sugar, which lowers insulin levels and reduces the liver's tendency to produce fat internally. Carbohydrates, on the other hand, must be refined and filtered. The liver doesn't tolerate fructose well, and fructose is one of the main triggers for liver fat accumulation. It's found not just in table sugar, but in soft drinks, desserts, fruit juices, and even some so-called healthy smoothies. In your 90-day liver recovery plan, limit fructose to less than 25 grams per day. Replace refined grains with whole grains like quinoa, oats, and brown rice. These release glucose slowly, minimizing insulin spikes and preventing the liver from converting excess sugar into fat. Fat intake requires quality control rather than complete restriction. About 25 to 30% of your total daily calories should come from healthy fats. Prioritize monounsaturated and polyunsaturated fats, olive oil, avocados, fatty fish, nuts, and seeds. These fats improve lipid metabolism and reduce hepatic fat synthesis. Minimize trans fats and limit saturated fats found in fried foods, processed snacks, and high-fat meats. When you choose fats correctly, you improve the way your liver handles triglycerides and cholesterol. Alcohol is non-negotiable. Even small amounts can dramatically slow liver fat clearance. During the entire 90-day recovery period, eliminate alcohol completely. Your liver cannot repair while simultaneously processing ethanol. Remember, every glass of wine or beer sets your progress back several days. Now let's look at the metabolic side. Insulin resistance is the main driver of non-alcoholic fatty liver disease. When your body becomes resistant to insulin, your pancreas pumps out more of it. High insulin tells your liver to store fat. The solution is to resensitize your cells. The clinical method for this is to space meals properly, maintain moderate physical activity, and avoid constant grazing or late-night eating. A 12 to 14-hour overnight fasting window, what we call time-restricted eating, has been shown in studies to reduce liver fat and improve insulin sensitivity. Exercise is another crucial therapy. The liver doesn't burn fat by itself. It relies on whole-body energy expenditure. The most effective routine combines aerobic and resistance training. Aim for at least 150 minutes of moderate-intensity aerobic activity per week, such as brisk walking, cycling, or swimming, plus 2 sessions of strength training. Building muscle improves glucose disposal and reduces fat delivery to the liver. Even if the scale doesn't move dramatically, your liver fat percentage can drop by up to 30% in 3 months with consistent activity. Let's translate all this into a structured 90-day plan. For the first 30 days, focus on resetting your metabolism. Eliminate sugary beverages, processed foods, and alcohol. Track your meals and reduce portion sizes by 20%. Increase water intake to at least 2.5 liters per day. Choose lean proteins and vegetables at every meal. Within the first few weeks, most people notice reduced bloating and better energy as their liver enzymes begin to normalize. From days 31 to 60, we refine nutrient timing and improve fat quality. Replace all cooking oils with extra virgin olive oil. Introduce fatty fish like salmon or mackerel twice per week for omega-3 support. Continue time-restricted eating. Finish dinner by 7 p.m. and don't eat again until morning. This allows your liver to mobilize stored fat overnight. Include at least 30 minutes of movement daily, whether it's brisk walking or cycling. At this stage, ultrasound imaging often shows reduced liver echogenicity, indicating fat clearance. From days 61 to 90, we focus on maintenance and restoration. Reinforce your protein intake, sustain your calorie control, and keep insulin levels stable. Add fiber-rich foods such as oats, chia seeds, and vegetables to support bile flow and detoxification. Continue avoiding alcohol and processed sugars completely. As you reach the 90-day mark, most individuals see normalization of ALT and AST levels, reduced triglycerides, and improved overall metabolic health. The liver becomes more efficient, energy levels rise, and abdominal fat diminishes. Let's discuss some key clinical markers you should monitor during these 90 days. Your doctor will likely check your ALT and AST levels, which reflect liver cell stress. GGT is another enzyme that improves as liver fat decreases. Triglyceride and HDL levels in your blood also tell us how well your metabolism is responding. Ideally, you'll see ALT drop below 30, triglycerides below 150, and HDL rise above 45. These are all signs of recovery. Now about hydration and micronutrients. Your liver needs sufficient water for bile formation and fat metabolism. Aim for consistent hydration throughout the day. Include sources of B-complex vitamins, particularly B12 and folate, which aid in liver cell regeneration. Vitamin D levels are often low in patients with fatty liver, so check and correct them if necessary under medical supervision. Sodium control is also important. Many people underestimate the salt hidden in processed foods, which contributes to water retention and blood pressure issues. Restrict sodium to around 2,000 milligrams per day by avoiding packaged snacks, processed meats, and fast foods. Replace with natural seasonings like lemon juice, herbs, and spices that enhance flavor without adding salt. One common mistake I see is replacing sugar with artificial sweeteners. Although they have fewer calories, many disrupt gut bacteria and may worsen insulin resistance. Instead, train your palate to prefer less sweetness overall. If necessary, use small amounts of natural stevia as a transitional aid. Sleep is another clinical pillar. Poor sleep increases cortisol, which promotes liver fat accumulation. Ensure 7 to 8 hours of quality sleep every night. Keep your sleep schedule consistent and avoid heavy meals right before bed. When you sleep well, your liver performs its nightly detoxification functions efficiently. Now let's talk about progress tracking. Reassess your liver function tests every 4 to 6 weeks. If numbers improve, continue the plan. If not, evaluate calorie accuracy, adherence, and possible hidden sources of sugar or alcohol. Consistency is key. Most failures occur not because the plan doesn't work, but because it isn't followed precisely. Remember, the liver is the only organ capable of complete regeneration. Within 90 days of disciplined dietary management, the liver can shed significant fat, reduce inflammation, and restore normal function. You will notice clearer skin, better digestion, improved energy, and even weight reduction. However, I want to be clear. This plan is not a one-time fix. The habits you build in these 90 days must continue if you want lasting liver health. After the 90-day reset, you can slightly increase calories for maintenance, but keep the same nutrient ratios. Continue exercising, stay hydrated, and avoid alcohol. This is how you protect your liver for life. To summarize the essential clinical rules, maintain a 20% calorie deficit, eliminate added sugars and alcohol, increase lean protein intake, choose healthy fats, perform regular physical activity, and ensure quality sleep. These are not optional. They are the proven pillars of liver fat reversal. So take control of your liver health starting today. Your body has an incredible ability to heal when given the right environment. Feed it with clean nutrition, give it rest through fasting windows, and move daily. the liver will respond with renewed vitality, restored function, and freedom from fatty liver disease. And when your next blood test comes back, showing normalized enzymes and improved metabolic numbers, you'll know that your commitment has paid off. 90 days from now, your liver can be leaner, stronger, and healthier than ever, if you begin today. Thanks for watching.